Guys, welcome again to my channel, and this will be the part 2 video of the shoulder joint. So here we are going to be learning about the bursas related to the shoulder joint, the relations, the nerve supply and the blood supply. So let's get started. So now bursas related to the shoulder, there'll be subacromial bursa, subdeltoid bursa, subcoracoid bursa, subscapular bursa, infra and supraspinatus bursa. I'll show you the diagram. See, you see here the green color structures. Okay, this one is your subdeltoid bursa. You see, this one is your subacromial. Actually, what happens is subacromial and subdeltoid bursa are actually continuous. Okay, subacromial bursa continues as subdeltoid bursa, so they are together known as subacromial bursa only, and they permit smooth motion. Then you have subcoracoid bursa. Subcoracoid bursa is here under the coracoid process, your subcoracoid bursa. Then you have another one. This is your subscapular bursa. Then you have your subcoracoid bursa that I already told you under the subcoracoid. Under the coracoid process. This one is your subscapular, and this one subdeltoid, subacromial. Okay. These are the bursas. You don't have to explain them. If you just write the names, that's enough. Okay, now relation. It is one of the complicated topic that took me a lot of time to remember, but now it's very easy for me to remember it because I have mastered the diagram of this particular relations. When you know the diagram, you don't have to mug up these. Okay, you can just draw the diagram, and along with that you can also remember the relation. So there is a diagram, we will sketch it together, and on the same time when we will sketch it, we will write it here. Okay, so make sure when we will sketch this, we will sketch it and we will connect this diagram to the writing part also. Then let's do sketching. This one, you do it. I'll just do it with the colors that should be of the particular structure. This is your glenoid cavity. Okay, then you will have your labrum, synovial fluid, all those things, your joint cavity. This is tendon of biceps. Don't worry, I will mark everything. So let's have muscles in red. No, let's have muscles in reddish brown. Yeah, both of them. This is your coracoid process, which is the one I made now. We'll label everything. Don't worry about that. For now, just let me sketch it. You can also have a notebook with you and keep marking along with me so that you know how to draw it, right? Okay, that is the ligament, so we will have it in a dark green color. This is a ligament. This one is tendon. This is a ligament. The bursa should be colored in pink. Yeah. So okay, one by one. See, one thing, I'll mark it here also if it confuses you. You can also do it so as to prevent confusions. This is superior, inferior, anterior and posterior. I've also written it here: superior, inferior, anterior and posterior. Yeah, so the first thing, we'll go for the superior relationship. See, you see here there are 5 in total. Okay, superior relation, inferior relation, anterior, posterior, and a relation within the joint. Within the joint, that means inside the joint. Baki relations are actually surrounding the joint. Okay, so that's the difference. Now we go for the superior. Let's mark it. Superiorly, you have an arch that is called your coracoacromial arch. This one, this arch, your coracoacromial arch, this one. Acromion, this is your coracoacromial ligament and your coracoid process. This is the first one, your coracoacromial arch. Then if you go below, this is your subacromial bursa, your supraspinatus muscle, and then your deltoid muscles. This one and this one, both of them are deltoid muscles. Okay, we'll mark it. First I said you this one. Okay, this whole thing is your coracoacromial arch. Okay, we already studied it in the stabilizing factor. Then we have this one, deltoid. See, you should know one thing very clearly. I'll be taking class on deltoid also. Deltoid has 3 fibers: anterior, middle, and posterior. So on the anterior side, it will have anterior fibers, right? Simple logic. This is also deltoid. This is what? Posterior side. So this will have your posterior fibers. This will be your posterior fibers, right? And you don't have to show the middle fibers. Then this I told you, coracoacromial arch, then your subacromial bursa, then I told you your supraspinatus, there is no space, supraspinatus muscle. Okay, if you want, you can color it properly so that you don't get confused with the muscles and the nerves. The nerves are the arteries. This is muscle, right? People color it properly when you do it for your exams. Okay, so your superior relation is done. So superiorly, we'll write it here now. See, whatever we did in the diagram, we'll write the same thing. Okay, one by one. Superiorly, you have 4. Remember, you have 4. Okay, the first one is your coracoacromial arch. The second one is your bursa, subacromial bursa. See, you see here the subacromial bursa, then your supraspinatus muscle. You write here supraspinatus. I'll write muscle as M, okay? Then the fourth one is your, I told you, deltoid. Both the deltoid, the upper parts will come here. Deltoid muscle. Okay. Now we'll go for the inferior relationship. Inferior relation will have 3. Yeah, 3 in total. We'll see here. See, this is one of the muscles. For inferior, you can have a mnemonic. That is man. M-A-N, man. Okay, I'll write it, don't worry. So let's mark it first. This is your muscle. I'll label it, don't worry. This is your muscle. And I told you it is M-A-N. So there will be one artery. M for muscle, A for artery, and N for nerve. That will be with yellow color. So let's label it. I told M. M will be the muscle. This is the long head of triceps brachii. Okay. Then this is the artery. That is M-A-N. M-A. A will be your posterior circumflex humeral vessel artery. Then this one, N. N for nerve. Your nerve is axillary nerve. Okay, so M-A-N, muscle, artery, nerve. Just remember it like that. We'll write it here now according to the diagram. The first one, The first one, long head of triceps, that is your M. Just remember it, MAN. Okay, I'll write it here also with some M. The mnemonic here will be MAN. Okay, so yeah, long head of triceps will be the muscle. Then A for, see, we wrote here posterior circumflex humeral artery, and the nerve will be your axillary nerve. Now we'll go for the anterior and then posterior. For anterior, you have 4 muscles in anterior. Okay, let me mark it first. Inferior is done. Anterior. Anteriorly, if you go from inside to out, there are 4 muscles in total for an anterior relation of shoulder. This is your deltoid, I told you. Anterior fibers of deltoid. Then short head of biceps. Then this one, coracobrachialis. See, short head of biceps and coracobrachialis actually have been drawn commonly from coracoid process because they commonly originate, the short head of biceps and the coracobrachialis, both of them, they commonly originate from the tip of the coracoid process. Okay, when I take them separately, you will understand it more clearly. And this one, the fourth one is your, you can have it here, I'll write it in small, subscapularis. Okay, I'm sorry if it is a little dirty. This one, subscapularis. So totally 4 muscles. We'll write it here. Anterior. First one is your deltoid, anterior fibers. Second is your, see, short head of biceps. Third is your coracobrachialis. And the fourth one is your subscapularis. Okay. Now we'll go for the posterior relation. You see, posterior is this side. In posterior, you have 3 muscles in total. See, deltoid, posterior fibers of the deltoid. This one, infraspinatus. And this one is your teres minor. Okay, these are the 3 that you will have for your posterior. Let's write it again. 1, you write 3 here, you write 4 here. Yeah, so the first one is your deltoid, posterior fibers. Second one is your infraspinatus, which I marked here, infraspinatus. And third one is your teres minor. These are the superior, inferior, anterior and posterior relation. Within the joint, you will have only one. Okay, within the joint, this is only one. I will just mark it properly so that you don't get confused. Within the joint, see, can you see here? This one, yeah. This is your tendon of long head of biceps brachii. Okay. This one, where do I mark it? Tendon of long head of biceps. That's it. Within the joint, there is only one relation. We'll write it here. Tendon of long head of biceps brachii. Okay. See, just have a look. This is the thing. Now we'll go for, see, relation is done. Superiorly, we have coracoacromial arch, we have the subacromial bursa, then we have supraspinatus muscle, and then deltoid muscles. Then inferiorly, we have your triceps brachii muscle, that is M. A for axillary, that is posterior circumflex humeral artery. A for artery, I'm really sorry, and N is for nerve, that is axillary nerve. Then you have anterior. Anterior fibers of deltoid. There are total 4 muscles in anterior relation. Anterior fiber of deltoid, then your short head of biceps brachii, coracobrachialis, then you have your subscapularis. For posterior, you have 3 muscles: deltoid posterior fibers, infraspinatus, and teres minor. Okay, and within the joint, you have one, that is your tendon of long head of biceps. You can make this diagram for relation, and if you remember this diagram properly, there will be no confusion in relation when you write the relation of the shoulder joint. Okay, this is all about relations, and now we'll go for your blood supply and nerve supply. For blood supply, you can remember the mnemonic PASS. PASS. Okay, this is the mnemonic that you can remember. PASS. So for P, this is posterior circumflex humeral vessels. Vessels means artery as well as nerve, artery as well as vein. Vessels, we say vessels for artery and vein. So it is posterior circumflex humeral artery and vein. So in short, we are saying it vessels. Then for A, we will have anterior circumflex humeral vessel. You can learn it like that, posterior and anterior. So posterior circumflex humeral vessel, anterior circumflex humeral vessel. For the first S, we will have subscapular vessels, and for the next S, you will have suprascapular vessels. That is how you have to remember this. You have to understand and mug it up. There is no other go. And next topic is your nerve supply of the shoulder joint. For that, you just remember a name, Sam, because that was the only thing that came to my mind. So Sam is the mnemonic for nerve supply. See, one thing that is common in blood supply and nerve supply will be suprascapular. Okay, there you had suprascapular vessel. Here for S, you will have suprascapular nerve. Then for A, you will have axillary nerve. And for M, you will have musculocutaneous nerve. Okay, so suprascapular nerve, axillary nerve, musculocutaneous nerve. Now the next topic will be movements at the shoulder joint. I'll just tell you the names of the movements. That is, we'll take it in a pair to remember it in a better way. The first one will be your flexion and extension. The second one will be your abduction and adduction. Third is your medial and lateral rotation, and the fourth one is your circumflexion. So yeah, this is all for today's video. And actually, I want to take the movements and the muscles causing the movements in a separate video. I will be taking it in the upcoming video, as well as the clinical anatomy. I hope that you liked it and it was clear enough. Please let me know any suggestions or any ideas that you would want me to inculcate in my videos, and any topic that you want me to make very soon for you people. And please subscribe, like, and share this channel. Please support and show your love. Thank you, everyone.